joining us. This is the COVID-19 Vaccines Ask the Expert. Today we have Dr. Lori Carrier, who oversees clinical operations with Heartland, practices family medicine and psychiatry. We also have Emma Ruschel here with us. She earned her undergraduate degree in biology and chemistry from Illinois College in Jacksonville. She then continued her education at the University of Pennsylvania and earned a PhD in cell and molecular biology, specifically gene therapy and vaccines. She gained extensive experience researching vaccines for emerging infections, such as MERS and Zika, as a postdoctorate fellow with Dr. Weiner at the University of Pennsylvania. Most recently as a staff scientist at the Wistar Institute. She had the opportunity to lead a clinical research group working with academic and industry partners. They have helped develop vaccine candidates for MERS, Zika, and COVID-19. So thanks so much for being here to both of you. And we're going to start with some basic information about how vaccines work and the specific vaccines that were developed for COVID-19. And then we'll go into the questions that were submitted. And then you will also have a chance to submit questions via the chat box as well. So Emma, if you want to go ahead and get us started, the first slide talks about how vaccines work.
Sure. Thank you very much for inviting me here today. So vaccines in general, they work by allowing your body to recognize a germ, which could be a virus, a bacteria, or any other infectious disease. So recognize it before you become infected. So this is a really powerful strategy to prevent infection rather than having to treat it afterwards. And so COVID-19 vaccines in particular are designed to allow your body to develop immunity to the virus that causes COVID-19, which is SARS coronavirus 2. And one thing to keep in mind is that vaccines typically take a few weeks to produce immunity, and that's because it takes some time for the T and B lymphocytes in your body to respond to the vaccine and ramp up and be ready to attack the virus when you become exposed. So it is possible that if you are exposed to the virus just before or just after you get vaccinated, you could still become sick because the vaccine didn't have enough time to produce an immune response and provide protection to you. And if you go on to the next slide, there's some nice pictures to show how an immune response works. And this is just like a kind of general big picture view, but the way that your immune system responds to infectious diseases is by recognizing little bits of, in this example, virus that is infecting a person. So in this picture on the left, there's little red spike proteins, and those are like representing the pieces of the viral surface. And so what happens if you become infected with a virus like that, there'll be little bits of virus protein that your immune system can recognize. And so that big brown blobby cell is called an antigen presenting cell, and those cells are all in your body all over the place, and their job is to kind of roam your body looking for something that doesn't belong. And so in this case, that antigen presenting cell would find a little bit of viral protein, engulf it and degrade it inside the cell, and then display it on the surface, where it would then travel to talk to your immune cells, in this example a helper T cell, and display a little bit of that viral protein. And if that helper T cell can recognize it, it will activate and then go on to the right side of the slide, where you can see the helper T cell then can find a B lymphocyte, which are the cells that produce antibodies. And so that helper T cell helps the B cell produce antibodies that are specific for that specific viral protein. So in this case, it would be a SARS coronavirus 2 spike protein. So now your body can produce antibodies. And on the next slide, you can see how those antibodies are able to provide protection to you if you then become exposed to the virus. So antibodies are able to recognize the virus and can bind to it and prevent it from infecting you. They can also target it to get for degradation or other ways of killing the virus. And one thing to remember is antibodies are really important for preventing infection, but there are other types of immune cells in your body that are also really important, and these are called activated killer T cells. And so those antigen-presenting cells I mentioned before can also activate these killer T cells, which can recognize infected cells and kill them, which is important to help limit the spread of an infection. So together, the antibodies and the killer T cells are what protect you from infection. On the next slide, you can see some like a schematic of different types of vaccines. So on the top, you have a virus that is the example here. And so on that first row, there are some types of traditional vaccine technologies that we've used for a really, really long time: live attenuated vaccines, inactivated, subunit, and conjugate vaccines. And these are the ones that are really common in lots of like the childhood vaccines that everybody receives. And also the flu vaccine, seasonal flu vaccine that you hopefully get every year is a whole inactivated vaccine. On the bottom are some of the newer vaccine technologies that have some really great advantages of being faster to develop and cheaper. And so you'll notice on the list are nucleic acid vaccines, which are particularly relevant because the two COVID-19 vaccines that are available right now in the United States are both mRNA vaccines, which are a type of nucleic acid vaccine. So on the next slide, there's a little bit more information about a few of these specific vaccine technologies, and these are the ones that have been used so far with most success for coronavirus. So on the top, you can see mRNA vaccines, which are what are most relevant for us today. And they work by containing a little bit of the viral mRNA that allows your cells to produce that surface protein from the virus, the spike protein. And that's what your immune system can recognize and then stimulate the T and B lymphocytes in your body that will remember how to fight the virus and protect you from infection. So there are other coronavirus vaccines in development, and a lot of them are in clinical trials already. And so some of those technologies include the protein subunit vaccines, which are similar in that they use just a little bit of the virus to induce an immune response. So you don't have to use the whole thing, which makes them very safe. But they work very similarly in that the one surface protein of the virus is what's used to induce an immune response and activate your T and B cells in your body. Vector vaccines are also being developed, and they are a little bit different. They work by having a different virus as kind of the delivery mechanism. And these are either, they are usually not replicating, which means that they're not able to make copies of themselves and infect you as the vaccine because they're not able to replicate, which makes them very safe also. And they're basically just the delivery mechanism for the vaccine, which then induces the immune response in your body. So on the next slide, you can see I just thought this was interesting to show how many different vaccines for COVID-19 are in development right now. And it's in preclinical development, there are over 200 of them. And you can see that over time, some of them move into phase 1, 2, and 3 clinical trials, which are when vaccines are first tested in people. And then on the far right, you can see a few of them are in use now. Worldwide, there are several different ones that have been used, and in the United States, the two on the top there, the both RNA platform, are the two that are available right now in the U.S. So on the next slide, you can see a little bit more detail about how mRNA vaccines work. On the left, number 1, this is a schematic of what the SARS coronavirus 2 looks like. And again, you can see on the surface of the virus, there's those spike proteins, which is what it uses to attach to a host cell and infect it. And so the vaccine, the mRNA vaccine, is designed to take a little bit of that viral mRNA, which codes for the spike protein. So it's just the mRNA for that single gene, and then it's encoded in a lipid nanoparticle, which is basically like an oily shell, which does two things. It helps keep the mRNA stable because it's not very stable on its own, and it also serves as a delivery mechanism. So the vaccine itself, then when it enters a cell, it will be injected into the muscle, usually of your arm, and then those lipid nanoparticles are able to fuse with your muscle cells, and the mRNA gets into the cell cytoplasm, where your cell will treat it like it does any other piece of mRNA that's there, and it will translate it into a protein, the spike protein, which can then be displayed on the surface of the cell as either a whole spike protein, or it can be broken up. Your cell does this all the time, breaks up proteins and displays little bits of them on the surface of the cell. And that's how those antigen-presenting cells we talked about before can come by and recognize this little bit of a foreign protein and induce an immune response to target it. So on the next slide, this is some details about the Pfizer Biointex mRNA vaccine that's available in the U.S. It's comprised of 2 shots, 21 days apart, delivered in the muscle of your upper arm, and it is currently recommended for people 16 and up. It does not contain eggs, preservatives, or latex. And the next slide shows similar details for the Moderna vaccine. Again, very, very similar, mRNA-based, 2 shots. These are delivered 28 days apart, again, in the muscle of your upper arm. And it's recommended for people 18 and older. And it also does not contain eggs, preservatives, or latex. And I think on the next slide are common side effects, and I will turn it over to Dr. Carrier.
Sure, thank you. Thanks so much, Emma, for that information. It's so useful to kind of understand how these are made. I'm going to talk about common side effects, things to expect when you get an immunization. And one thing I'd like to say is it's not necessarily specific to the COVID vaccination. You'll see that a lot of this is very similar to what you'd expect if you're getting a flu shot or your annual flu shot. So, of course, we have been administering the immunization in the deltoid in the upper arm, where we give many injections. And so you can have some local effects there, a little bit of pain, redness, swelling, most common 12 to 24 hours after getting the injection. Usually mild, but sometimes folks have used Tylenol, ibuprofen, or a cold compress if it's uncomfortable. And then sometimes after the vaccination, you can feel your body mounting that response. You might get some flu-like symptoms of usually it's a low-grade fever, chills, tiredness, headache. This seems to be more common with the second immunization, so that either that dose at 3 or 4 weeks, depending on which immunization you get. So who should not get vaccinated? If you've had a severe allergic reaction to the COVID vaccination, so the first time you've gotten a COVID vaccination, or if you've had an allergy to any component of the immunization, we would not recommend that you get the second shot or even the initial shot. Now, in terms of knowing what ingredients are in there, you'll see on point 4 here, they mention polyethylene glycol and also polysorbate. Those are the 2 ingredients that are actually in the at least the polyethylene glycol is an ingredient in the Moderna injection, and that is commonly known as Miralax. So you might hear that we've prescribed that a lot through the clinic for constipation. It's a very rare medication to have an allergy to, but if there is an allergy to that, because it is an ingredient. So you'll see that both staff and patients will be asked directly about that as an allergy. In the past, if you've ever had a severe allergic reaction to another immunization or to an injectable medication, that doesn't mean you wouldn't get the injection necessarily, but we would make sure that we do it in the right place. That might be one that we administer at a hospital setting versus an outpatient clinic setting. Or if it's more of a mild reaction, we'll just make sure that we observe for an extra period of time rather than the 15 minutes. Benefits of getting vaccinated. So the COVID-19 vaccination is obviously a very important tool. It's kind of the light at the end of this pandemic. And the more folks we get vaccinated, and the quicker, ideally, the sooner that we'll start to go back to life as normal. Wearing masks and social distancing, we would continue to stress that, and we'll continue to help reduce the chances of being exposed to the virus. But again, those measures, obviously, we've been, pushing them thus far, and they're not enough. So vaccines are a really important part to getting beyond this pandemic. And obviously, the combination of getting the vaccination and following these measures is our best protection. And these are all the tools that we have available right now. And so we want to do whatever we can to help educate and stress the importance of getting these immunizations. Happy to talk about any more questions. I think just on the side effect, I don't know, I think there was a point on this, but I might have skipped through it. In terms of a reaction to the injection, it usually happens within the first 15 minutes, which is why after an immunization, there is a 15-minute observation period. It's very important to honor that and have somebody be around other folks. If they have a history of allergies, it would be a 30-minute wait period, just so there's that extra time. But ultimately, those reactions usually happen within the first hour, but mostly up to the first 4 hours. And the reactions can be very mild from hives, but all the way to anaphylaxis, which is why we do strive the importance of that observation period and having the appropriate monitoring, and even medications like an EpiPen and Benadryl in the presence of administering these immunizations. Again, it's rare, but it's a new vaccination, and that's kind of the one thing that we're always looking out for, and then reporting if we experience.
So I'm just going to say real quick, so we posted some common questions, some questions that we received through the Microsoft forms we sent out, and then I also have some questions here in the chat box, and if anyone else has any other questions, please go ahead and type them in, and we will start getting to those. So the first question is, if I've already had COVID-19 and recovered, do I still need to get vaccinated with a COVID-19 vaccine?
I can take this. Emma, jump in. You are definitely the vaccine expert, so feel free to jump in at any time. Just speaking from the clinical standpoint, we definitely recommend still getting the COVID-19 vaccination. We do know that there are some antibodies that folks will have after they've had COVID and recovered from COVID. We don't know how long those antibodies are going to last. And we also don't know if those antibodies can, one, prevent us from getting COVID again, and definitely don't know if it can prevent us from getting new strains that we're hearing about on the news coming in. It does look like there's good data for our current COVID vaccinations that do protect us against these other strains that are coming in and are seen to be very contagious. So we would definitely recommend, even for folks who have had COVID and who have known antibodies based on testing, that they would go ahead and get the vaccination.
Will a COVID-19
I don't have anything to add. That was perfect.
Okay, thank you.
Will a COVID-19 vaccination protect me from getting sick with COVID-19?
It is our best chance of helping somebody prevent becoming sick with COVID-19. So that is exactly, the vaccination works by teaching your immune system how to recognize and to fight the virus. So it is our best protection against getting sick with COVID-19. There is, you know, even with a flu shot, I think this question comes up a lot. Well, I've gotten the flu shot and I still got the flu that year. What we do know with vaccinations is when people are infected, despite having had the vaccination, that usually the illness that they endure is less severe and also helps to decrease morbidity and mortality. So decreases hospitalization rates, decreases ICU rates, and definitely decreases mortality from that illness. So so is it possible to get COVID-19 if you have the vaccination? Sure, because this isn't 100% effective, but we are in the high 90s. But if you're in that small percentage, the likelihood of it being a much less severe illness is the reason to get it as well.
Can a COVID-19 vaccine make me sick with COVID-19?
I can take that, but this, Emma, if you have, again, this is more about the vaccination. Actually, Emma, do you want to take this one?
Sure. Yeah, definitely the vaccine cannot make you sick with COVID-19. There is no way for it to cause infection because it's not the whole, it doesn't include the whole infectious virus. So there's no way for it to make you sick. Sometimes people will think maybe it did make them sick because the vaccine can take a little bit of time to work. So if you're exposed to the virus in the community or at work or someplace, within a few days of getting vaccinated, you can still become sick from that exposure to the actual virus. But there is no way that the vaccine can cause COVID-19.
Do we know how long immunity is expected to last at this time? Timeframes. Does the vaccine have the same benefits and protections for the new COVID strain?
So I can take a stab at this question. We know for sure that the approved vaccines in the United States are protective for at least 3 or 4 months. And the newest data that's out there suggests that they will be protected for quite a while longer than that. We don't know for sure exactly how long yet. But we also have some data, I think so far as Pfizer has released a little bit of data on their vaccine, that the new strains that are out there, it does look like their vaccine will be effective against those strains as well. And I am sure Moderna is working on doing those same sort of experiments to answer that question, but because the vaccines work almost exactly, like they're so similar to each other, they work exactly the same way, I would expect them both to be effective against the new strains.
Can I take the flu shot with this vaccine?
So the recommendation from the manufacturers and the CDC is to separate the immunizations by at least 14 days. So we are not currently giving the flu shot and the COVID vaccination on the same day. We would separate it by at least 14 days on either end of that COVID vaccine. So if you just got the flu shot, you'd want to wait at least 2 weeks for the COVID vaccine.
Has the COVID-19 vaccine caused death?
I have not seen any reports of death from the COVID vaccination. We know there's been some reports of anaphylaxis that have been successfully treated. Again, that's the importance of doing this in a safe way, in a safe place with a safe observation period. But I have not seen any record of death caused by the immunization. Emma, I don't know if you have any more info or if you've heard anything.
Sure. Yeah, there have been no deaths linked to the vaccine. During clinical trials, and now that we've vaccinated a whole lot of people in the, in the healthcare setting and general public as well, there are like people die of other things after being vaccinated sometimes, but that does not mean that the vaccine caused the person's death. So unfortunately, during clinical trials, some people have died from things like heart attacks, but they were not caused by the vaccine.
Can I spread the virus to others in any way after I've had both doses of the vaccine?
I can I can take a stab at this. So we don't know for sure yet how effective the vaccines are at preventing asymptomatic infection and the ability for someone to have such a mild infection that they don't know they're sick and potentially being able to spread the infection. I think that it's probably very unlikely that the vaccine will not reduce the risks of that happening. But because we don't have a whole lot of data yet, it's still really important that you continue to wear your masks and social distance as much as possible, even after you've been vaccinated. I don't know if you want to add anything to that, Lori.
No, I think that, yeah, I would agree. That's what I know as well.
If I've had both doses of the vaccine, do I have to wear a mask around someone who also had both doses?
At this time, we are recommending to continue the appropriate measures in terms of wearing a mask and also social distancing. Emma, I don't know from the scientific standpoint if there's any thoughts about when that would cease or at what point in terms of, community being immunized that some of these measures would let up. But I do know in current times we're continuing to stress the importance of those while more of the population is immunized.
Yeah, I would just add that we'll kind of take our lead, I think, from the CDC in terms of when they'll start removing some of those recommendations to continue wearing masks and stuff like that. There is, if we can get enough of the population vaccinated to achieve herd immunity, then that's when we would be able to start, not having to wear masks and go back to, not having to do some of the social distancing and things like that. But it's just a little too early to know exactly when that will happen at this point. So we'll have to wait and take our cues from the CDC.
Are there any updates, new information, or recommendations for breastfeeding mothers?
Emma, do you want to take that from the studying the immunization, and then I can tell you what we're telling our folks like from a clinical standpoint.
Sure. So from the kind of scientific end of things, there's no reason to think that the vaccine would cause any risk to a breastfeeding baby. There's no way for the vaccine to get to the baby. There is actually some potential benefit to the baby from being able to take in antibodies that the mother's body will produce in response to the vaccine. Those can be transferred to the baby through the breast milk and can provide some protection to the baby from infection. So there's really no scientific reason to think there would be risk to the baby, and there is some reason to think that there might be a benefit.
Yeah, that's essentially what we're telling our patients when they ask, and our staff. Essentially, we've immunized our staff thus far, and we had a lot of questions about that. So we do have some kind of user-friendly written information that I can share with Jamie, who could share with staff if there's more questions about both breastfeeding and pregnant mothers. But ultimately, yeah, it looks like there isn't a scientific reason not to take the immunization. And I will say, after immunizing 125 of our staff, we did immunize several folks who are breastfeeding and pregnant. And after reading this information, they felt very comfortable taking the immunization. So I'm sure we'll have more and more data coming out as we study it more, but it looks like it is certainly safe.
Dr. Carey, you just touched on this, but the next question is it safe for women who are or become pregnant?
So we definitely recommend having the conversation with your OB if you are either looking to become pregnant or are pregnant in that moment, just so you can discuss your own health history with your provider. I will say that having had a deep conversation with our OB about this, there's very infrequent reasons where an OB would recommend a pregnant patient not have the immunization, and really it almost comes down fully to allergies. So again, last week we immunized our staff and immunized several pregnant women through that who had that conversation and felt very comfortable getting immunized. In fact, because there's been so many, subjectively as well, but we've had many pregnant women who come in to deliver and are positive at the time of delivery, maybe even asymptomatically, but it can really disrupt that delivery experience and your ability to care for your baby after you give birth, and then also the follow-up care after that. And so ultimately we would strive for folks who are thinking about becoming pregnant. It's ideal to get that vaccination before the pregnancy. There's also been some reports of third trimester COVID cases have been of all the trimesters. It seems that has been one where having COVID during that trimester has had more morbidity and hospitalizations, early deliveries necessary, and some complications around that. So I think for all of those reasons, OBGYNs are definitely stressing getting the immunization as early as possible within a pregnancy, and even before pregnancy if there's planning in action.
Yeah, I agree with all of that, and I'll just add that again, kind of from the scientific point of view, there's really no reason to think that these mRNA vaccines would cause any issues during a pregnancy. So there's really very, very little even theoretical risk involved in being vaccinated during a pregnancy.
Should we decline the vaccine if not under direct service or client-facing role? Will remote admin staff be offered the vaccine? So, Dr. Carey, I don't know if you want to speak just about, in terms of your staff with Heartland, what the recommendations were, and then I can speak about the plan for Trilogy.
Sure. Of course, we've been given limited supplies from CDPH, and the supplies we've been given have been for frontline staff, so patient-facing staff. So that's not just providers or MAs, but also our front desk staff, folks who are working in the clinic. Obviously, you have many folks doing outreach, and they would fall into that kind of frontline staff. So if you are offered the vaccination, I would recommend taking the vaccination because the way that the CDPH is at least releasing them is for the appropriate tiers. So you wouldn't necessarily be offered unless you fall into that tier. And then I can turn it over to you for when remote staff will be offered. I can just speak for Heartland. What we're expecting is that, again, folks who are working from home who aren't forward facing, we are not immunizing yet because we are really preserving that limited supply for folks who are patient facing. So we haven't necessarily even offered it to those to that staff yet, but we will as soon as we can.
So for Trilogy, we haven't heard yet how many vaccines we are getting or when they will be available. In the survey we did complete for the Department of Public Health, we did report on the full number of staff that we have at Trilogy. So our hope is that everyone will be able to receive the vaccine, but at this time, until we know more about how what the supply will look like, we don't have that clear answer on that quite yet, but we will make sure to let you know as soon as we get an update from public health officials. All right, so I've got quite a few questions here in the chat box. We'll get to as many as we can, and then as if we don't get to any of them, we'll record them and send out answers to everyone. How do you know if you have an effective hand sanitizer? What can a person do to keep their hands moisturized?
I can take that, or go for it, Emma.
Yeah, go for it. Oh, I was just gonna say that you want to aim for hand sanitizer with, I believe it's at least 70% alcohol content, because that's what does the sanitizing. And in terms of, I feel you, my hands are dry and cracked, especially now that the weather is cold and dry. I try to put lotion on every time after I either wash my hands or use hand sanitizer, and that has helped me personally. But I don't know if you have any other better suggestions.
No, I completely agree. So ideally 70% alcohol content. And I will say if you if you have very dry hands and you put lotion on them overnight and even put on a pair of rubber gloves overnight, it can really like saturate your hands and really moisturize them and help repair. And obviously trying to do some moisturizer during the day is important, but that overnight, if you just kind of it can do wonders. And oil works as well. So if you have like baby oil, things like that that are really strong, can help with moisturization.
Thank you. I just heard that the super strain has reached Indiana. Will the vaccine cover that strain? And are there any new precautions we need to take regarding these mutations?
I can speak to whether the vaccine is likely to protect against them. And from what we know, yes, we don't have tons of data yet because these strains are so new, but the data we do have suggests that yes, the vaccines are able to induce antibodies that are able to recognize these new viral strains and should be protective. And in terms of the precautions, I think you should keep doing the same things that we're doing now, wearing masks, social distancing, avoid gatherings as much as you can, and then get vaccinated as soon as you're able to.
Great, thanks. Keeping motivational interviewing techniques in mind, how might you address a client who reports they do not want to take the vaccine because they do not believe it is safe?
Well, I did hear a quote or was reading an article a colleague passed off just that says public health moves at the speed of trust, which I think seems very accurate. And I think it's really helping with the trust of the system. I mean, and kind of understanding where that mistrust might come from and even what those questions are. So obviously we want to meet our clients where they're at. We want to meet our staff where they're at in terms of how they feel about vaccinations in general, but particularly about COVID. And so being able to just like answer those baseline questions, even with information that Emma provided today, I think has been helpful for us, even with our own staff. So yeah, it is about trust and trying to, trying to give facts and science that can help instill trust. So we recognize that it's not going to be an easy feat for some people, and just wanting to provide that extra education and learning what questions they really have so we can get at the base of them.
Why is the second vaccination recommended starting at 16 years and not 18 years old? So I think Pfizer and Moderna had different recommendations of the starting age to be vaccinated.
Yeah, so I can answer that. The reason is simply because the Pfizer vaccine was tested when they did their clinical trials. They included people as young as 16 years old. Whereas in Moderna's clinical trials, they didn't include anyone under 18. And so that's why the official recommendations are for those age ranges, because those are the ages that we have data in. So it's just because that's how the clinical trials were designed and the ages that the vaccine was tested in first. I can also say that I think both companies, definitely Moderna and I believe Pfizer as well, are currently running clinical trials in younger people. So I think it's 12 and up. So I think as those studies progress, we'll potentially see the recommendations change to immunize younger people as well.
What happens if you miss the second dose of the vaccine?
Emma, do you want to take that, or I can? Whichever.
Sure, I can speak to that, and then maybe you can tell me if there are specific clinical recommendations that you guys are doing in the clinic. But from a scientific point of view, if you miss the second immunization, you would just likely have a less intense immune response, you would have a potentially lower levels of antibodies and be slightly less likely to be protected from infection. Although there is some data from the clinical trials that some percentage of people are protected after a single immunization, but definitely protection is best after the second. So I don't think there's anything dangerous about getting only one immunization, but I do think you are most likely to be protected if you get both of them.
Yeah, I'll just add, when we were giving our staff Moderna, so they gave us a little bit of information, and it sounded like, agree, one vaccination is better than none, and 2 vaccination is ideal. It looked like the numbers changed from like 54% like level of immunity or effectiveness. I don't want to use the wrong term. That would then go up to that 94.5% or whatever the second level of effectiveness is after that second dose. So we have heard as well at this point that if the second dose is missed, we ideally recommend it at that 28 days. It doesn't have to be right at that 28 days, but we would try to do that 28 days or as soon after as we could, because we also know we're more likely to get folks in and have them complete this regimen. But if they do miss that second dose and come back a month later or 2 months later, it sounds like we will be able to give them that second dose and not restart a series.
Thank you. Another question we have is, what vaccine would you recommend, Pfizer or Moderna?
From the clinical standpoint, we would recommend whichever one you are offered or is available to you. But Emma, I don't know if you have any more specifics on the different types.
Yeah, I would say scientifically they are so similar to each other. I expect them both to work almost exactly the same, and so far that seems to be the case. So I don't think that there's any good reason to pick one over the other at this point. They're pretty much exactly the same.
And just in terms of like allergy and clinical, like what we're asking about screening for clinical, there's not one question that would say, oh, you should get Pfizer versus Moderna at this point as well, because they do share some ingredients. And so that wouldn't change you getting one versus the other. It would just change for either how we monitor afterwards.
In case someone missed this earlier, if I get the vaccine, am I still able to carry COVID?
Yeah, we touched on this a little bit earlier. So right now we don't really know the answer to that question. So it's possible that you could still carry COVID even after you've been vaccinated, which is why we recommend continuing with face masks and social distancing and everything like that. There will be more data available as we move forward and continue studying these vaccines, and so those recommendations may change in the future, but for now we're just not sure.
What if there are long-term effects, maybe years from now, that we are not aware of?
I can say from a kind of a big picture vaccine standpoint that there's really no reason to think that vaccines cause effects that aren't seen for years later. There are some well-known side effects to vaccinations, which we talked about, similar, sore arm, fever, headache, but really any side effect from the vaccine is going to happen easily within the first few months after being vaccinated. So there's really no reason to think that there's going to be some unknown side effect that won't show up for years later. That said, we do follow all clinical trial participants for at least a full year after during the clinical trial. And all companies that produce vaccines are required to watch for any rare side effect that may only be visible. If something happens very, very rarely, you may never see it until you, roll out a vaccine to the general public. And so all of those, that data is collected, and vaccines are monitored for any sort of those rare side effects that might not be seen until you vaccinate a lot of people. But there's really no reason to think that a vaccine could cause something that doesn't show up for years later.
I would, agree with that, and trusting the science certainly on the vaccine. I think I'd have much more concerns about COVID, the infection itself, having both short and longer term effects that we're still kind of learning about now. And so, so just in terms of the comparison, I think the vaccine has more evidence as to and we know more about it in terms of having studied it, and so yes, the vaccine seems like a safer bet than COVID infection.
Is it safer to wait until other types of vaccines become available?
So I think there are other vaccines in development, and so I think it is definitely very likely that others will eventually be available, but it's impossible to know when and how long it will take. And I think it's safer to get vaccinated and avoid being infected as soon as you can, because we know there are some potentially some pretty severe effects of COVID infection. And there's really no reason to think that the currently available vaccines are problematic. They've been shown to be safe and effective. So I would not want to wait for a different type if I were eligible to get one of the vaccines that's available right now.
I wholeheartedly agree with that answer.
If I get the COVID vaccine, do I still need to quarantine for 14 days if I'm exposed or travel?
For now, I know we're following CDC guidelines, kind of gives us this information, and we kind of follow their guidelines. So for now, we are still following the travel quarantine based on whether you have the vaccination or not. I think, again, as we have more of the population immunized and there's more of that herd immunity, those will get more information from the CDC on when that will make a difference in terms of ability to travel and not quarantine. I don't know, Emma, if you get any like pre-information on that or any thoughts in terms of how quickly that.
No, sure. I agree with what you said. Yeah, I think once we get enough of the population vaccinated, those recommendations may change. And also once we have some better data on whether vaccinated people are still able to carry the virus and transmit. So potentially once we have a good set of data that says, either way, what the answer to that question is, those recommendations could change. But I don't know how soon that'll happen or not.
Thank you. And the last question I have here is, so if it's only approved to last 3 to 4 months, does this mean we need to get vaccinated again 4 months after our first vaccination?
I can take a stab at this. So you're right that the data we know for sure right now, you're definitely protected for at least 3 or 4 months. Right now, I know the focus is on getting as many people their first, 2 vaccines as possible. And the scientific community as a whole is definitely going to keep following kind of those first clinical trial participants as long as possible, and we'll have a lot more data to know for sure how long protection lasts kind of as time goes by. It's one of those things where we kind of just have to wait and see to know how long protection will last. I think it's likely to last at least a year, if not longer. That's just my kind of personal opinion based on the science from this vaccine and others that I've seen, but we won't know for sure until we follow people long term. So we'll see, but right now definitely there's no recommendation to get vaccinated again in 4 months. But we'll see if this vaccine provides protection for potentially several years or not. One of those things we just kind of have to wait and see what the data shows.
Great. Thank you both so much. Those are all the questions I saw in the chat box. I don't know if there's any kind of final closing remarks from either of you.
You know, I'm at Trilogy every Thursday morning seeing patients, and I am happy to answer more questions as they come up in terms of like one-on-one, because I know it, you know, it's an interesting time and there's always new information, but I would just stress that that this is really an exciting light at the end of the tunnel of darkness of 2020. And so I'm hopeful that we can get a large percentage of our population immunized.
I would just echo those sentiments. I'm really excited that we have vaccines available now. And I think it's one of the, light at the end of the tunnel. And I hope everybody feels the same way, and we can get vaccine rolled out and get back to normal.
Great. Well, thanks everyone for joining us. Special thanks to Dr. Carrier and Emma. And Emma, thanks for barring through some technical difficulties. Glad we were able to get you on and have this presentation this morning. This session was recorded. The link will be sent out to all of Trilogy. And as Dr. Carrier mentioned, please continue to ask your questions. If we don't have answers right away, we will make sure we get we write down your questions and make sure we get back to you with an answer. So thanks everyone. I hope you have a good rest of your Tuesday. And yeah, thanks for joining us.
Thank you. Bye.
Bye.
Thank you.